Ready? Okay. So I'm about to give an IV piggyback. And first thing I want to do is make sure my physician orders and my MARA matches up. So I have my physician order and my MARA. I'm going to check the patient's name, which is Janet Green. I'm also going to check what medication she's receiving. She's getting gentamicin. Okay, that matches 80 milligrams by IV piggyback every 8 hours. And that matches up on both the physician orders and the MARA. Gonna check for my patient's allergies, and she's allergic to penicillin. That also matches up on both of them. Okay, so she's getting the right medication, right dosage, right time, and right route with the right medication. All right, at this time, I want to check for allergies. Like I said, she's allergic to penicillin. I am going to look up my medication to see if it's compatible with what her primary fluid is. So she's receiving D5, so I'm going to get my book, my drug book, look in the back, and see if it's compatible with D5. And according to the book, it is compatible with D5, okay? I will then look up my medication. All right. So I would check the dilution. And here's my medication. And I would, the medication is 50 milliliters. And it is within the normal dilution. She's supposed to receive 80 milligrams. So I would check to make sure that's a safe dose, and that is a safe dosage. And she's receiving it by IV piggyback. I would get my medication, and I would have got the label, wrote down my medication, the amount of it, the day and the time that I'm giving it. I would check my expiration date on my medication to make sure it's not expired. Check for discoloration. Check for any type of particulate matter in it. Make sure there's no leakages and that it's still sealed. I will also put the patient's name and room number and the time that I'm going to start. Okay, so once I get that looked into, I need to check what kind of labs that I need to watch for. And we know gentamicin is an antibiotic, so most likely she probably has some kind of infection. So I want to check for elevated white blood cell count and the CBC. Also want to make sure, check to see if she has any type of renal impairment, and check for her BUN and creatinine. We're going to also be watching for like her urine output. Okay, so once I know I get all of that situated, I will go and calculate how much I'm going to give my patient. At this time, go ahead and do hand hygiene. Okay, so she's receiving 80 milligrams. So, and then this is in 50 milliliters, and she has a 10 drop set. Okay, so she will be getting 8 drops per minute. And all right, and also I meant to say the medication is given between 30 to 60 minutes. So I'm going to choose to do it over 60 minutes. And that comes out to 50 milliliters an hour. Okay. So I'm going to get all of my materials together. Got my medication, got my drop set, I got my MARA, and I got my physician order. So I'm going to go over here to the patient. Have everything set here. I need to make sure I got everything I need. Like I said, I got the drop set, my medication, tubing. If I needed a syringe or whatever, I'm gonna make sure I have that, and make sure I have enough of my antiseptic wipes. I'm going to look at my patient's IV site, check for any signs of infiltration, check for any redness, tenderness, any drainage, any swelling. So I don't see any of that. I would then lower my primary fluid just to see if I get good blood return. That also let me know that it's pertinent. So I got good blood return. So that IV site is still patent. All right. I would go ahead and do hand hygiene again. Ask the patient, do they have any allergies again? She would tell me that she is allergic to penicillin, and I can also match that to her MARA in the physician orders, which states that she is allergic to penicillin. Okay, at this time, I will be educating my patient. I can go ahead and do that now. Let her know, like, you are receiving gentamicin, so you're receiving gentamicin, which is an antibiotic, and it's mostly used for infections, and you're going to be getting this through your IV line, so you don't have to worry about getting poked again right now. And to let her know, you know, watch out for increase or decrease in urine output. Also, let her know we'll be monitoring her lab work, her CBC, and her white blood cell count, and to let us know if she has any type of dizziness, chest pain, or shortness of breath. Okay, I'll go ahead and put my gloves on. Well, I tell you what, before I put my gloves on, I will go ahead and get my IV stuff set up. So I'll open it up. All right. Get my tubing together. Here's my medication. I would go ahead and take this off. Okay. Without touching. Oh my gosh. That was not supposed to happen. Okay. Take the lid, this off. And I will insert it. Okay. And I will prime my tubing. Keep the top on, but just open it up so I can get all of the air out of the lining. Okay. Without wasting any medication. So once I prime it, all right, cut it off. I will put that up here. I would drop my primary fluids. Where is one? I would drop this somewhere. Just make sure it's lower than. I tell you what, let me make sure. Everything's closed right now, so I would. Drop my primary fluid. Here this goes. All right, so my medication will be over that. I will go ahead and then put my gloves on. Gloves towards I'll get a new pair. Okay. I would clean my hub. All right, and I would clean the hub closest to the bag. Clean it for about 15 seconds. All right, dispose of that. Then I would take the cap off without touching it so I don't break sterilization. And then I would insert it. All right, it's inserted. I will use my primary tubing to do my drops per minute. Open it up and then start looking for my drops. And then I would, since she has 8 drops a minute, we're gonna do 4 drops every 30 seconds. And then I'll do it for a full minute. I'm gonna start now.
Getting the medicine to go.
When I remember after,
Slow down a little bit. I'm going to have to do another 30 seconds to make sure I got the correct. Right now. I'm gonna start looking at it for a whole minute, starting now. 1, 2, 3, 4, 5, 6, 7, 8. Okay, so I got 8 drops a minute. All right, so while the medication is going, I will still look for signs of infiltration. No redness. Make sure the no redness or tenderness. Ask the patient how they feel while the medication is going. I would get my MARA and I would document. I would document my patient's name, the medication that they're receiving, which is gentamicin, how much medication they're receiving, which is a total of 80 milligrams, but that breaks down into 8 drops a minute, and there's also 50 milliliters an hour. I will put my patient's reaction, make sure they didn't have any itching or burning or any breathing problems, what time I started the medication, and the route that I started, which was by IV piggyback. And also do my nurse's notes on my MARA. After the patient has received their medication, I would have took these gloves off also, but after the patient has received their medication, I will come in and I would disconnect the secondary line. Okay, so I would disconnect the secondary line. I'm gonna go ahead also and put a fresh pair of gloves on while I'm disconnecting. Also, this will be the time you can still continue to educate your patient about, you know, signs and symptoms to look for, any type of output or anything like that. So I would disconnect. I will bring my primary tubing back up. Get rid of this. Put my primary tubing back at its regular rate, whatever it was, and that's my assessment.